Hello, my name is Abigail Wescott, and today I will be teaching you about how quarantine is affecting the nation's mental health. Our lesson objectives today are to better your understanding of COVID-19, understand why quarantine is affecting mental health, learn how to cope with quarantine, and learn mental health strategies to better personal mental health. COVID-19 is a newly discovered coronavirus that causes respiratory illnesses in people and is extremely contagious. A coronavirus is a common type of virus that causes upper respiratory infections, for example, the flu or the common cold. The symptoms of the virus are fever, cough, shortness of breath, and newly diarrhea. This virus originated in Wuhan, China from an unknown source. They think it is a fish market that started it, but they're not entirely sure. There are about 2.2 million cases worldwide. COVID-19 spreads from person to person. The virus can be transmitted through touching infected objects, respiratory droplets, such as mucus or saliva flying whenever you are talking or sneezing, or if you cough. Back to the touching infected objects. The virus can live for up to 5 days on certain types of objects. Wearing a mask can help prevent the spread because you're not getting your respiratory droplets on everybody else. Quarantine can be defined as separating and restricting people's movements to stop the spread of a disease or virus. Quarantine makes people feel as if they are trapped and have no control over their own personal situation, such as not being able to go to work, not being able to freely go to the supermarket, not being able to have fun like the park. This can cause feelings of confusion. Makes people lack sleep. It causes depression, type symptoms, and irritability. The list goes on. Substance and alcohol abuse have been studied to become more prevalent after being in a quarantine for prolonged periods of time. This is the continuation of the previous slide. Being locked in one's home can cause paranoia and post-traumatic stress type symptoms. Different people handle stress differently, which is where substance abuse and alcoholism come in. People that handle their stresses in this type of way go back to those destructive lifestyles because they think that's the only thing that can help them. There are resources at the bottom of this slide if you know someone that is having issues with these type of issues. There are lots of strategies to cope with COVID, being locked in your home, such as establishing a routine for yourself. If you work from home, set specific times that you're going to work, and then set specific times you're going to do chores, or you're just going to set some time for yourself. Find activities that are going to keep you busy and entertain you. Something that's going to give you a sense of purpose in your daily life since you cannot go to work. Make lists for yourself, like lists of things to do, lists of things you want to do outside of quarantine. Just try to keep yourself busy and set on a set track to keep yourself not getting bored. Try to stay active, do simple home workouts to try to stay healthy, try some new recipes. Try to keep a normal sleep schedule. Sleep is very important because it helps to boost your immune system. Only stay informed. Don't stare at the news about everything that's what is happening. It can just cause more anxiety. If you're feeling overwhelmed or you know someone that is feeling overwhelmed, there are online therapists and resources that are free to use. For example, you can find those at BetterHelp. Where did COVID-19 originate? The answer to that is Wuhan, China. What is the definition of quarantine? Quarantine can be defined as the isolation of groups of people in their homes or a hospital to help stop the spread of a disease or virus. What is one coping strategy that can be used to cope with quarantine? One strategy is to set a routine for yourself. Make lists, just try to keep busy. And these are my references.